What vaccinations and preventive care do they require? Vaccinations and preventive care play a crucial role in maintaining the overall health and well-being of individuals. Not only do they provide protection against potentially harmful diseases, but they also help in preventing the spread of contagious illnesses. When it comes to vaccinations and preventive care, it's important to understand what is recommended and required in order to ensure the best possible protection for yourself and your loved ones. The World Health Organization, WHO, and various health organizations across the globe have identified a set of vaccines that are considered essential for everyone. These vaccines are generally administered during childhood, but they may also be recommended for adults depending on their specific circumstances. Let's take a closer look at some of the most common vaccinations and preventive care measures that are required. 1. Childhood vaccinations. Children are particularly vulnerable to infectious diseases, which is why it is crucial to ensure they receive all the necessary vaccinations. Some of the most important childhood vaccinations include measles, mumps, and rubella, MMR, vaccine. This vaccine protects against 3 contagious diseases: measles, mumps, and rubella. It is usually administered in 2 doses, with the first dose given at around 12 to 15 months and the second dose at around 4 to 6 years. Diphtheria, tetanus, and pertussis, DTaP, vaccine. This vaccine provides protection against diphtheria, tetanus, and pertussis, whooping cough. It is usually administered in a series of 5 doses, with the first dose given at around 2 months and the final dose given at around 4 to 6 years. Polio vaccine. Polio is a highly infectious viral disease that can cause paralysis. The polio vaccine is usually given in a series of 4 doses, with the first dose given at around 2 months and the final dose given at around 4 to 6 years. Hepatitis B vaccine. Hepatitis B is a viral infection that affects the liver. The hepatitis B vaccine is usually administered in a series of 3 doses, with the first dose given at birth or during the first few months of life. 2. Adult vaccinations. While childhood vaccinations provide a strong foundation for disease prevention, it is equally important for adults to stay up to date with their vaccinations. Here are some of the vaccines recommended for adults. Influenza vaccine. The flu vaccine is recommended for adults annually, as the flu virus is known to mutate and change strains each year. The vaccine is especially important for individuals with weakened immune systems, pregnant women, and adults over the age of 65. Tetanus and diphtheria, TD, vaccine. Tetanus and diphtheria are bacterial infections that can have serious complications. The TD vaccine is usually recommended every 10 years for adults to ensure continued protection. Human papillomavirus, HPV, vaccine. HPV is a sexually transmitted infection that can lead to cervical cancer and other types of cancer. The HPV vaccine is recommended for both males and females up to the age of 26. Pneumococcal vaccine. Pneumococcal disease can cause pneumonia, meningitis, and bloodstream infections. The pneumococcal vaccine is recommended for adults over the age of 65 and for individuals with certain medical conditions. 3. Additional preventive care measures. In addition to vaccinations, there are several other preventive care measures that can help in maintaining good health and reducing the risk of diseases. Some of these measures include regular checkups. Regular visits to a healthcare provider can help in detecting potential health issues before they become major problems. These checkups often involve blood pressure monitoring, cholesterol level checks, and screenings for various diseases. Screening tests. Depending on your age and gender, certain screening tests such as mammograms, pap smears, and colonoscopies may be recommended to detect early signs of cancer or other diseases. Healthy lifestyle choices. Adopting a healthy lifestyle that includes regular exercise, a balanced diet, and limited alcohol consumption can significantly reduce the risk of various diseases, including heart disease, diabetes, and certain types of cancer. Hygiene practices. Simple measures like washing hands regularly, maintaining good oral hygiene, and covering your mouth and nose when coughing or sneezing can help in preventing the spread of infectious diseases. In conclusion, vaccinations and preventive care are fundamental in safeguarding our health and the health of those around us. From childhood vaccinations to adult vaccines, staying up to date with the recommended immunization schedule can provide crucial protection against potentially harmful diseases. Additionally, adopting preventive care measures and maintaining a healthy lifestyle can further enhance our overall well-being and minimize the risk of various illnesses. It is essential to consult with a healthcare professional to understand the specific vaccines and preventive care measures that are required based on individual circumstances.